We've got two videos left before we complete this module, and they're both fairly brief. The first one is on frustration and aggression. We often make the assumption that frustration and aggression are closely linked or inevitable, but in fact that's not true. Frustration does not always lead to aggression. In fact, we consider it a very evolved and high-order coping and social skill when people can take various feelings such as frustration, anger, or any kind of internal discord and turn it into a positive coping strategy, or even better yet, use it as an empowering emotion. So for example, I wouldn't be doing this course with you if I didn't have some sense of frustration about the services or lack of services that sometimes are out there for people with mental health needs. Frustration can be a very powerful influence. But for many of the people we work with, social learning has reinforced aggression. They have grown up believing that the way to respond to a person not meeting their needs or perceiving them as not meeting their needs is to get angry and aggressive. Now, I want you to think about it this way. As you grew up, perhaps your parents taught you how to use a variety of different tools. If you were really lucky, by the time you got to be a teenager, your father or mother had demonstrated to you how to use kitchen implements in the kitchen and power tools in the workshop, how to use sporting goods in a sporting arena. But imagine now that your family only taught you how to use a hammer. And not only would you use a hammer in every workshop project from that point forward, but you'd try to bring a hammer into every sporting event or use a hammer in the kitchen. And that's when it really would stand out as being an aberrant or inappropriate tool. But that's really a great metaphor for some of the experiences that individuals have had. So you might be encountering somebody who's 35 or 40 years old, but during their developmentally critical periods, they were around people who never understood or never valued the teaching of new coping and social skills. So many people only have one tool in their toolbox or rarely go to the other tools. One of the primary modifiers of aggression is the intention attributed to the frustrator. And what this means is, in plain language, they're going to be more likely to be aggressive towards you if they perceive your intention as one of trying to hurt them or one of being aggressive toward them. Because, of course, we don't think of it as aggression anymore when a person is being perceived as aggressive to us. We now think of it as self-defense. So it's very important for us, even if we know that we're going to communicate with somebody about something or in a way that will likely frustrate them, to make sure that we don't aggravate that frustration by coming across in any way that might be perceived as aggressive or intimidating. In other words, we kind of have to find this balance between our poise and not being overpowering. We want to make ourselves small but confident at the same time. And that is something that takes a real touch and takes some practice. Some of the things we can do to reduce and prevent frustration are support and accompaniment of a trusted other. In other words, find out from that person, invite them to have somebody else be a part of the interaction that they trust. It may be that you're working with another staff person that they have come to know or trust more than you. And when that circumstance arises, we need to set aside our ego in the interest of professionalism and effectiveness and play that tag team wrestling game where we are going to go and do something else while our partner, who's established more of a rapport, connects with that individual. And that's a really important thing for us to do. But oftentimes that support comes from another person entirely, not another professional. It might be a family member, and oddly, it might even come from a member of the community who they've just met. At least the person from the community comes across as being neutral, if you understand my meaning, whereas you might represent that authority figure we spoke of earlier. So sometimes it's really as simple as finding a person who seems interested in caring from the community and asking them if they'd like to participate in a small way, such as sitting with a person who's upset while you go and talk to their family. Some really simple things sometimes that demonstrate openly to the individual that you're trying your best to meet their needs and that they're caring, so that even though they may not like what's happening to them, they can tell that you're not wanting to be hard on them. We talked about this earlier when we talked in the optional content about the BC ambulance, but if you can possibly find a way to transport that person's personal effects, then please do so, or allow them to hand them off to a trusted colleague or to put them in safe storage. For people who are in the policing community, this presents some challenges when what the person possesses is drugs or drug paraphernalia. And so sometimes it's important to ask that individual before, if they're not being considered criminally, if they're being assessed for a mental health apprehension, whether or not there's anything that they have that's private that want to give to somebody else or put in storage before they come along with you and before you search them. And again, this can be a really simple way to avoid frustration and escalation. First responders have to use active listening skills, empathy, concreteness, and immediacy skills to promote their perception as helpers, and then not as threats. And luckily for you, that's what's coming up in the next modules. So it's really important for us, even though we're not counselors, to use some of the exact same skills that are used by counselors and other people who have an active listening component. In other words, hearing and listening are totally different things. Hearing is a passive process. You can do it without looking at somebody and without stopping whatever activity you're doing, but it doesn't necessarily mean that you A, have understood, and it B, definitely doesn't show that you have understood or that you care. Active listening is a process that tells other people that you are listening, that you're understanding, and that you care. And those concretely exhibited behaviors can go a great way to helping you to avoid a person escalating or becoming aggressive, and even more towards continuing a relationship that allows you to maybe get beyond that crisis phase with that individual. We also have to employ our rational detachment. Rational detachment simply means that we allow logic to prevail and that we don't take the circumstance personally. We have to realize that when a person is agitated, it's often because of things that have come into their life much sooner or much longer before we ever got there. Some of them go back to their childhood, and some of them just happened earlier in that day. You happen to be, in some cases, the straw that broke the camel's back. So it's important for us to not take it personally. It's vital because frustration is a reciprocal thing, and the more that we demonstrate frustration, the more that we're going to elicit it from others, and then it becomes cyclic. So we will both escalate rapidly if we are not rationally detached. Often when people talk about being professional, what they mean is being rationally detached, staying cool when all around you are losing their head. And I teach my students a very simple expression that goes like this: the more unprofessional the other person is being, the more professional you must be. And that's the simple equation. The more upset the other person is getting, the cooler, calmer, and more obviously cool and calm you must be. Helpers must always be mindful of their inner narratives, so their inner voices, and that's really important. We've talked about homing the homunculus, really being able to understand what it is that those inner messages are saying to us and responding to them, not responding to the inner narrative that tells us to be judgmental of people, to defend ourselves, or to automatically explain or defend for others. And those are very deep-seated inner narratives. Those are habits that are very hard for us to break because they're not morally wrong, they're strategically ineffective. So you may not be doing something that's morally wrong when you tell somebody that you're defending your partner's behavior or the behavior of another staff person. It isn't that you're doing something morally wrong, it's just that it's not going to work.